Okay, so I'll give everyone just like another minute or so, only about half of you. Yeah, great. Glad to see more people join in. So Sahar and Samuel, could you guys pop your camera on? Okay, Samuel, I'm going to give you another shout out. Samuel, I'm going to give you another minute to go ahead and turn your camera on, but please do so we can get started. Okay, so Samuel, I'm going to send you a direct message here, but if your camera doesn't come on, I'm going to have to remove you from the class. Hey, Robert, thanks for coming. You're also going to need to pop your camera on. Thank you, Samuel. Robbie, you're the last one. Please pop your camera on.
No. No.
Okay, so we're going to go ahead and get started. For the classmate that's in the car, I'm just going to ask you to leave. If you haven't missed more than 20%, it's not going to affect your grade. So you can go ahead and take care of your car stuff and then log in if you get a chance to get home. But you can't be in your car dealing with your car stuff when you're in class. Okay.
Jesus, 84. Oh, boy, yeah.
So a 1-year-old with pneumonia A mist tent with oxygen, worse nurse with which nursing intervention is the highest priority? To give small feedings, keep a bulb syringe at the bedside, chart the breath sounds, or encourage the siblings to visit?
Hmm.
All right, so a couple of you, pretty good. Yeah, so pneumonia, little kids also kind of like it's a 1-year-old. They don't really have the biggest airways, so they tend to have problems with managing their secretion. So keeping the bulb syringe at the bedside, you would probably do all of these things, but this is one of those priority questions. So making sure you can get rid of their mucus. So the purpose of the knee to chest position in children with tetralogy of Fallot is to decrease pulmonary blood flow or to increase pulmonary blood flow. So very good, you guys. Yeah, we talked about this a couple times. The purpose is to increase pulmonary blood flow. So nice job. So you're caring for a child with tetralogy of Fallot who suddenly becomes cyanotic. Was that 60%? What is the first action? Administer morphine, prepare to administer IV fluids, administer oxygen at 100%, or place the child in the knee to chest position.
What do you want? Come here.
Yeah, so this is kind of a review of the same question that was just previous to that. So that's always going to be your first priority is you're going to put their kids in the knee to chest position to try to increase their blood flow back to their lungs. Sometimes you will give morphine to help them relax. That'll kind of help their pulmonary blood flow. And you might give IV fluids. Oxygen is also a pulmonary vasodilator. So potentially you would do all of these things, but your first action is going to put to the child in the knee to chest position. So what can cause rheumatic fever? Vomiting, strep throat, diarrhea, or UTI? So good job. It's strep throat. Almost all of you guys knew that. Very nice. So signs and symptoms of rheumatic fever include heart valve damage, partly arthritis, chorea, or subcutaneous nodules over the joints. And I think this is a select all that apply, and up to all of them can be correct. Yeah, so all of those are correct. We talk the most about the heart valve damage because sometimes they end up needing heart surgery, but all of these are potential signs and symptoms of rheumatic fever. So to remember, it's really a systemic disease. It's not just something that involves the heart. The heart is talked about frequently because in developing countries, it's a leading reason for children to end up needing heart surgery. So rheumatic fever and rheumatic carditis diagnostic findings. What would you be looking for if you suspected those diagnoses? ESR, a C-reactive protein, getting an ECG, and testing a myoglobin level. And it's also a select all that apply. Yeah, so the only one that you wouldn't be getting is the myoglobin. But the reaction, the inflammatory markers, and the EKG are common diagnostic tests when you're evaluating someone for rheumatic fever or rheumatic carditis. So a VSD creates a left to right shunt, which leads to excessive pulmonary blood flow and pulmonary pressure, which results in what? Peripheral edema, pulmonary ischemia, or pulmonary hypertension. All right, so this one is a little bit tricky. I think because in the question it says, and pulmonary pressure, like the short-term result of a VSD, an ASD, or a PDA, any of those left to right shunts, is increased pulmonary blood flow and pulmonary edema. But once you have that increased pulmonary pressure, they have pulmonary hypertension. So this is kind of a tricky question, but if a VSD, an ASD, or a PDA gets left untreated, they ultimately develop pulmonary hypertension. So select all that apply. What are the signs and symptoms of hypothyroidism? Cold intolerance, constipation, weight gain, or bradycardia or bradycardia. Right, so weight gain is not, I'm sorry. I was thinking of hyperthyroidism. So you guys did great. Yeah, so all of them are correct. Good job. Got my hypo and my hyper confused. So what is parallel play? Playing with other children, playing alongside other children, but not with them, playing alone, or playing checkers with another child. Yeah, so it looks like all of you that are participating got that one right. So that's very good. That's when they play near each other, maybe even with the same type of toy like blocks or something, but they're not playing with each other. At what age or which age does a child begin parallel play? 2 to 3, 0.2 years, 3+ years, or 0 to 2? Okay, yeah, so very good. 2 to 3. You don't really expect to be, parallel playing, but once you're in that toddler years, that's when you really anticipate that they start parallel play. So what type of infection is acne? Local bacteria, fungus. This is another select all that apply, but it didn't pop up on the screen correctly. All right, so it is both local and bacterial. So systemic would be all over your body. Acne tends to be localized to a certain part of your body, and it is a bacterial infection. So most of you guys got that right. This medication treats both acne and sinus infections: tobramycin, ciprofloxacin, penicillin, or doxycycline. All right, I'm impressed that several of you knew this. So doxycycline, specifically, it's frequently used for acne, but it could also be used for sinus infections. So a usual treatment for an infant with hip dysplasia is a body cast, a Pavlik harness, triple diapering, or aggressive physical therapy. All right, so yep, it is the Pavlik harness. So there are multiple questions about the harness in this lecture. So if we didn't touch on it very much in class. So if I were you, if you have like a notepad, if there's something in here that you don't recognize, I would make a note of it to go back and review it, because like I said, Dr. Bogart kind of targeted this HESI to questions that students missed last year on the HESI. So another select all that apply. How do you diagnose hip dysplasia in an infant? A positive Ortolani maneuver, the effective leg is shorter than the other, asymmetrical folds in the buttocks, or the foot points inward, or. So it's select all that apply. Right. So the only one that was not correct was the foot pointing inward. But so the Ortolani is when you lay them on their back and you push their knees towards their chest, and then you roll their hips out, and you'll hear a clicking noise in the hip that's has the hip dysplasia. The asymmetrical folds, that's when you're looking at the back, kind of where their thighs meet their butt. So if those are asymmetrical, that's a sign that there's a problem. And then the one leg being shorter than the other one. Which of the following are included in nursing care of myelomeningocele? Assess urinary function, place infant in the supine position, use latex gloves when providing care, and assess neurological function. So this is another one, and this is multiple correct answers. Select all. So very good. So the myelomeningocele, there's a couple questions in this Kahoot. This is where like part of the spinal column comes out. You'll see like a little sac of the spinal column on the outside of the body. So they tend to have problems, neurological problems with movement and sensation below wherever the myelomeningocele is. So you assess urinary function because it's usually in their lower back, but they can have bowel and bladder problems because of the myelomeningocele. And then they assess the neurological function. You're not going to put them on lying position because you need to protect the sac. So they're going to have surgery where that's going to be put back inside their spinal column. And then they're a higher risk for allergies. So using any latex gloves for patients in this population. So a most important principle of nursing care in a child with myelomeningocele is asepsis, hygiene, exercise, or rest. So this one, very good. Yeah. Until they have that surgery, then they're at risk for infection. So your highest priority, this is specifically pre-op, is the asepsis. What priority nursing action must be taken for a baby with a myelomeningocele? Position the newborn in a supine position, protect the sac, assist with bonding, or NG2 placement. So very good. Yeah. So this one had the nice picture so you can kind of see the myelomeningocele. So your priority intervention is going to protect that. So obviously, like I said, the cell pre-op, they're eventually going to have surgery to repair that. But before they have that surgery, that's going to be your priority intervention. So the nurse is teaching epistaxis management to a patient, which would be appropriate. Tilt your head backward and pinch your nose. Blow your nose gently with your neck flexed. Lay down flat, place an ice compress over the bridge of the nose, or sit, lean forward, and pinch the soft portion of your nose. All right, so yeah, so this is just a fancy word for a bloody nose. So these are just your treatments for this is how you stop a bloody nose. So you sit, lean forward, and you pinch the soft portion of your nose. So what medication would you question if a person has epistaxis? Sudafed, aspirin, Tylenol, or none of the above? So very good. So aspirin decreases platelet aggregation, so you're at higher risk for bleeding. Sometimes people take aspirin for that reason. We don't think about this too much in pediatrics because of Reye's syndrome, most kids don't take aspirin. But certainly if someone has a bloody nose, if they were taking aspirin, you would be concerned about that. So if a baby is diagnosed with either epispadias or hypospadias, what would you teach the parents? The baby will need a urostomy. The baby can be circumcised before he leaves the hospital after birth. Circumcision will need to be delayed, or it will not affect the baby at all. Right. So the circumcision will need to be delayed. Sometimes they use the foreskin to repair the epispadias or the hypospadias. So they don't get circumcised as a newborn and they leave the foreskin there. And then when they do the hypospadias repair, they can, remove the foreskin at the same time because they'll use that skin for the repair. So when is surgery recommended for hypospadias? 6 to 12 months, 24 to 48 months, 12 to 18, or surgery is not indicated. All right, good job. So they don't do it right as they're newborn. They let them go home. Usually they still are able to urinate. It just kind of screws all over the place. So they do it. You definitely want to do it before you really start potty training. So, but if later in the first year. What does folic acid do for sickle cell disease? Folic acid helps make new bone cells. The yellow one, just ignore. Folic acid interferes with DNA and RNA to make red blood cells, or folic acid helps make new red blood cells. So yeah, this is not the best worded question, but good job. And this is true for anyone, not just patients that have sickle cell disease. So you do need folic acid to help your body make red blood cells. So this one I'm going to skip because it's a reiteration of the question that we just looked at. So in measuring urine output of an infant, 1 gram of diaper weight is equal to 1 milliliter, 2 milliliters, 3 milliliters, or 4 milliliters. Very good. So if you ever are helping somebody in the hospital, if you're taking care of a kid in the hospital in their diaper, you'll weigh their dry diaper and then you subtract that weight from the wet diaper weight, and that tells you how many milliliters of urine they peed. So another select all that apply. So the signs and symptoms of pyloric anastosis include forceful projectile vomiting, poor weight gain, the babies are always hungry, current jelly stool, or abdominal distension. Yeah, so the current jelly stool, you'll see this is very specific to a gastrointestinal problem called intussusception, where the intestine telescopes on itself. So like you have like segments of your intestine and part of it pushes into the other part, which causes an abdominal obstruction. So this current jelly stool is like very specific to that diagnosis. You might see it as a distractor in questions, but it only relates to intussusception. So first of all, projectile vomiting, poor weight gain, they're always hungry. And then they don't have abdominal distension because they're constantly vomiting. There's not anything in their stomach. So hypertrophic pyloric stenosis, the main symptom is upset stomach, diarrhea, projectile vomiting, or a palpable mass. So this is one of those, good job. So it is the projectile vomiting. Sometimes they have an olive-shaped mass, but the main symptom is that projectile vomiting. So causes of autonomic dysreflexia: urinary retention, dehydration, hypotension, or none of the above. So it is urinary retention. And I know this is something that we didn't really discuss in class. I want to highlight it since it, like I said, Dr. Bogart went through and looked at what students missed last year. So autonomic dysreflexia, it's something that can occur after a spinal cord injury. So it's like an involuntary response to pressure, usually like urinary retention, bowel pressure, also like changes in position. And when they have this, it's like an overreaction of their involuntary nervous system. They can develop hypertension, bradycardia, sweating. It can actually be like a life-threatening emergency. So like I said, it's post-spinal cord injury. So these patients will frequently be on a bowel and bladder regimen because the primary triggers are going to be a full bladder or a full like rectum full of stool. So autonomic dysreflexia presents with headache, hypotension, and bradycardia, headache, hypertension, and bradycardia, headache, hypertension, and tachycardia, headache, hypotension, and bradycardia. Yeah, so the hypertension and the bradycardia are the two that I most associate. There is also excessive sweating and the headache. Hopefully, try to put, hypertension and the bradycardia together to remember, as those are the things that really cause like the life-threatening part of the autonomic dysreflexia. So another select all that applies. Nursing interventions for autonomic dysreflexia: bladder bowel training, hydralazine for hypertension, feet at the edge of the bed, or give vasoconstrictors. Okay, so vasoconstrictors would raise your blood pressure. So you're not going to give those for someone that has autonomic dysreflexia. The bladder bowel training is probably the biggest thing that you do. Hydralazine, this is a medication that lowers your blood pressure and it doesn't affect your heart rate. So this is something that, and it has a rapid onset. So you could give this to someone that was having a crisis and it should bring their blood pressure down without lowering their heart rate. And then dangle feet at the edge of the bed. Rapid position changes can precipitate autonomic dysreflexia. Yes, so we are correct. So Lyme disease is caused by an infected deer tick. Is that true or false? All right, very good. And it's true. So Lyme disease treatment includes cryotherapy, doxycycline, nystatin, or colloidal oatmeal. All right, so it is doxycycline. So this is second time we've seen this medication today. So doxycycline is what you give to treat Lyme disease. So what side effect of Lyme disease treatment? What is a side effect of Lyme disease treatments? Migraines, soreness of muscle, swelling, or forgetfulness? Yeah, so we didn't talk about this, so you guys were probably randomly guessing, so good job. It is soreness of muscles. So select an appropriate snack for a child with osteomyelitis care. I don't understand this question. I'm not going to lie to you, so I'm going to go ahead and skip it. Propranolol is used to treat hyperthyroidism because it decreases thyroid hormone synthesis. Is that true or false? So that is false. So propranolol, this is a beta blocker, something you use primarily to lower blood pressure. It also lowers your heart rate. You would not use it for hypothyroidism. What is the primary use of PTU in the management of hyperthyroidism? To replace deficient thyroid hormone, to treat thyroid cancer, to increase production of thyroid stimulating hormone, or to decrease the production of thyroid hormone. Yeah, so if you have hyperthyroidism, then you have too much thyroid hormone. So this is going to decrease the production. So that's why you give that medication. If it increased to TSH, then they would produce more thyroid hormone. The symptoms of UTI in children include not eating, fever, cloudy, dark, bloody, or foul smelling urine, or all of the above. So it is all of the above. Very nice. Just on fire. Okay, the recommended schedule for DTaP is 1 month, 4 months, 8 months, and then 15 to 18 months, 2, 4, 6, 15 to 18 months, and then 4 to 6 years, or 2 months, 4 months, 6 to 15 months, or birth 1 to 2 months, and 6 to 15 months. All right, so I will send you guys an email today with the immunization schedule. So this is DTaP is one of the ones they get it pretty much every well child. So 2, 4, 6 months, 15 to 18 months, and then again at 4 to 6 years. So this is one of the vaccines that's part of their routine schedule that they get at every well child visit. So treatment for an infant with hip dysplasia is a body cast, the Pavlik harness, triple diapering, or the hip surgery, the Orphe. All right, so this is kind of getting into some information we talked about earlier in this hoot. So it is the Pavlik harness. So a sign you may note when assessing developmental hip dysplasia, 2 skin folds on the back of both thighs, hypotonic leg muscles, one leg shorter than the other, or bulging at the hip area. There's only one correct answer. Right, so one leg shorter. So 2 skin folds on the back of both thighs, that's normal. It's not normal if they're asymmetrical. So that's why the one leg shorter than the other is the right answer. You worry about if the skin folds don't look the same on both legs. So another select all that apply. Which immunizations are required for school age children? Varicella, measles, mumps, rubella, DTaP, and polio. All right, so very good. It is all of them. So the Pavlik harness must be worn 6 hours a day, 23 hours a day, 12 hours a day, or however long the baby can tolerate it. All right, so it is 23 hours a day, so it has to be worn almost all the time. So an infant with dysplasia will wear the Pavlik harness. What are appropriate nursing interventions? Maintain a flex and abducted position of the hips, maintain direct skin contact with the harness, take off the harness for bathing, or administer sponge baths. You're only going to choose one. Yeah, so they don't recommend that you take it off for bathing because it needs to be on for 23 hours a day. So you just do the sponge baths when they have the harness. So another select all that applies. A caregiver is teaching a patient with a Pavlik harness includes refrain from holding, checking for skin breakdown, understanding the child will be delayed, or to continue diaper around the harness. I thought it was the select all, I'm sorry. So yeah, so the main thing is the check for the skin breakdown. So they can hold them, they won't be delayed. And I'm not sure what she's trying to say with continue to diaper around the harness. So they usually, you still want to hold them, etc. And if they can't wear the harness, you can just put like a pad under them and keep them clean. So nursery interventions and patient teaching for treatment of head lice and scabies include clothing, linens, and bath articles should be cleaned in hot water, special carbohydrate to promote healing, complete isolation from the public, or cut off and shave all the hair. Yeah, so good job. You have to wash everything, and they're both very contagious. They spread throughout the family easily. So which comment by a parent whose child has head lice indicates that the nursing education was effective? So we're all using medication, bath soap to kill the lice. I washed all hats and linens in soapy water. I frequently checked the scalp for reinfection. We are no longer attending school. I'm homeschooling them. Yeah, so I understand why some of you might have chosen that one. It's kind of a prayer question. You know, the main thing is you got to treat it, so you got to wash everything. You do probably on some level want to recheck. You would also be, you know, making sure after you treated everyone that there wasn't a reinfection. Okay, select all. Which of the following nursing care interventions are appropriate for respiratory distress in infants? Suction, adequate environmental stimuli, maintain the temperature of the baby, and administer oxygen as needed for SATs greater than 90%. Yeah, so the only one, you know, they're really in respiratory distress. They need like a quiet, chill environment. So you're not going to be really worrying about environmental stimuli, but the rest of them are correct. So which of the following is the mainstay of nursing care for bronchiolitis in children? Adrenaline, hypertonic saline nebs. This is something they inhale to help loosen up their secretions. Salbutamol or corticosteroids. So yeah, we didn't talk about this one, but this is what we do first. It's just this hypertonic saline that they inhale and it loosens up their secretions, then you section them out. You might end up giving corticosteroids in a really severe case. Salbutamol is more of a long-acting too. We don't normally use that in kids. And then adrenaline, this would be like severe case, like they're in the ICU. So you would start with hypertonic and kind of loosen up the secretion so you could section them out better. So leading cause of childhood poisoning is plants, medicines or drugs, gasoline or flowers. So it is medicine and drugs. Tylenol is the leading one. So just to remember, even if they're over the counter, they can be dangerous for kids and adults. So teaching for prevention of UTI includes all of the following except void after sex, wear cotton underwear, wipe from front to back, or limit fluid intake. Right. So the one thing that you do want them to drink fluids, urinary stasis is a risk factor. So they should be drinking fluids, not limiting their fluid intake. So another select all appendicitis signs and symptoms include rebound tenderness, bloody diarrhea, abdominal guarding, or pain at McBurney's point. Right. So the only one you guys got good. The only one that wasn't sure was the bloody diarrhea. Nice job. So appendicitis signs ensued include localized pain, right lower quadrant. Pain improves with hip flex, nausea, vomiting, tender McBurney point. Is that true or false? Nice job, you guys. Okay. So this question I don't like. So I'm gonna, sorry. So a nurse is assessing a toddler who has cystic fibrosis. Which of the following findings should the nurse expect? Rhinorrhea, weight gain, visible peristalsis, or steatorrhea? All right, so we did not, I don't know if we talked about this word. This word means fatty stool. So when you have cystic fibrosis, you can't secrete the pancreatic enzymes that break down fat because your ducts get clogged with mucus. So as a result of that, you have these really fatty, frothy stools. So this is the one that you would expect with cystic fibrosis. They need to take supplemental pancreatic enzymes that will help that. So cystic fibrosis respiratory signs and symptoms include respiratory infections, chronic congestion, low tolerance for exercise, forced vital capacity, forced expiratory volume, increased speed and protection, use of accessory muscles, decreased pulmonary function, or all of the above. So it is all of the above. Nice job. So signs and symptoms of esophageal atresia or tracheoesophageal include excessive drooling, increased respiratory distress when feeding, choking and coughing, or all of the above. So very good. Yeah, this is one where you normally, a lot of times it's not diagnosed before they're born, but on their first feed, they cough and sputter because either the esophagus doesn't connect to the stomach or there's connect to the trachea and the esophagus. All of these are things that you would expect. Which of these is not a sign and symptom of transesophageal fistula? Unable to properly feed, current jelly stools, frothy saliva, or stomach distension? All right, so good job. This is the current jelly stools. I think I told you guys this is the one that's associated with intussusception. So this is your distractor here. These others you would expect. So patients with esophageal atresia and tracheoesophageal fistula may have which of the following signs and symptoms? Coughing, crawling, startling reflex, fever, shortness of breath, rosy cheeks, coughing, choking, cyanosis, coughing, choking, and runny nose. All right, so the best answer here is going to be your coughing, choking, and runny nose. This is, they end up aspirating, etc. That's why they have those symptoms. So impetigo teaching. Apply antibiotics over the scabs, apply Santyl to remove dead tissue from the wounds, remove honey crusts and clean before applying antibiotics, or clean and apply cotrimazole antifungal. So this is one that was part of the end of class, and apparently we didn't talk about it much. It is the bacterial skin infection, and it has these honey crusted lesions. So you wash those off gently, like maybe like a moist cloth, you kind of soak on there and moisten them and then rub them off. And then you put the antibiotics on the lesion. So another question about teaching with impetigo. cleanse with hydrogen peroxide, apply topical antifungal, give oral antiviral for 3 weeks, or remove crust after by soaking in 1 to 20 Burrows solution. So yeah, we didn't talk about Burrows solution. You can apply it to the skin for like irritated skin. You don't have to use Burrows solution. The main thing is you use kind of like a warm, moist rag to kind of loosen up the crust and then gently get them off before you put the antibiotics on. And to remember that it's antibiotics, so like the antiviral, antifungal, that you're not going to use that. And then hydrogen peroxide would be really damaging and drying to the skin. So another select all. What are digoxin heart rate parameters for an infant and child? So an infant, hold less than 100, infant hold greater than 120, child hold less than 90, child hold greater than 120. All right, so pretty good. This one is to remember that children have faster heart rates than adults. Digoxin lowers your heart rate, so you would not want to give it to a child that had a heart rate less than 100 because that would be a really low heart rate for an infant. So digoxin requires an apical heart rate for 1 minute prior to administration. Is that true or false? That is true. Very nice. So when might the infant experience physiologic anemia? 1 to 3 months, 2 to 3 months, 0 to 1 month, or 3 to 6 months? All right, so physiological anemia, babies are born with iron reserves they got from their mother that are stored in their liver. So they're gone shortly after birth. So you would really expect to see this 2 to 3 months, especially like an exclusively breastfed infant that doesn't receive any iron supplementation. They are at risk for this type of anemia because they burn through their iron stores that they were born with. So what causes rheumatic fever? This is kind of a tricky question. Bacteria, virus, overcompensation of the immune system, or contaminated food? So I thought about skipping this one. It's usually like the preceding infection is usually strep throat, which is a bacteria, but not everyone that has an untreated strep throat goes on to develop rheumatic fever. It's really the body's response to the untreated infection that leads to the systemic rheumatic fever. So just to kind of remember that like there is some element of a wacky immune response that is to a bacterial infection. So not everyone that gets strep throat and doesn't get it adequately treated will go on to develop rheumatic fever, but then people have this overcompensation of their immune system and they develop it. What sign is indicative of respiratory distress in infants? Nasal flaring, grunting, intercostal retractions, or all of the above? So it is all of the above. Very nice. Another select all. Identify the cardinal signs of respiratory distress in infants. Increased heart rate, nasal flaring, retracting, being cold and clammy, grunting, or apnea. Yeah, so a couple of you chose the and apnea. Like apnea, you would have respiratory distress in the worst case scenario. It would lead to apnea, and then cold and clammy. Certainly, cold and clammy is not a good sign, but it's not specifically related to respiratory distress. So the increased heart rate, the nasal flaring, retracting, and the grunting are really going to be the things that you think about in terms of the signs of respiratory distress in an infant. So the HPV vaccine schedule, do you give it at 7 to 8 years, 16 years, 11 to 12, or 18? Yeah, so 11 to 12, you want to give it before they're sexually active. You can give it later, but this is the ideal age range, the 11 to 12. So symptoms of diabetes mellitus include polyuria, polydipsia, hypoglycemia, weight gain, and fatigue. Is that true or false? So this one was tricky. So the weight gain makes this be false. They present more often with weight loss. They're peeing a lot. They're not able to use their food they're using as energy. They end up breaking down their fat as an energy source. So weight gain is not associated with diabetes mellitus. It's specifically type 1. So polydipsia and diabetes is caused by cellular starvation for energy, fluid loss via the urine, high osmolality, or acidosis. So this was kind of tricky. So polydipsia is the increased thirst when your blood is really, really concentrated with a high osmolality. It could be like a high sodium. In this case, in diabetes, it's going to be the high glucose. It does drive your thirst. So what causes autism? It's a pregnancy defect, a brain abnormality, childhood trauma, or there's no single cause. Right. So there is no single known cause for autism. So signs and symptoms of autism include cannot make eye contact, repeats words or phrases, hyperactivity, or all of the above. So it is all of the above. Very nice. So autism affects which areas? Communication, behavior patterns, social patterns, or all of the above? All right, very nice. All of the above. So the most common leukemia in children, ALL, CLL, AML, or CML. So good job. I know this is one that we didn't touch about in class. The two types of leukemia in ALL and AML, and the ALL is the one that is more common. All of these are reasons are seen in patients with ALL except fever, petechiae, infection, polyuria. So yeah, so leukemias are infections of or cancers of the bone marrow. So they can get infections. Petechiae because they are not able to clot normally. So the one don't really associate with problems with your bone marrow is going to be your polyuria. Which of these signs and symptoms are most common in the initial phase of leukemia in a child? A sore throat, a high fever, hyperactivity, or a low-grade fever? So I think the key phase here is this initial phase before they're really sick, they're more likely to have a low-grade fever. So kind of just paying attention to that. It's like the beginning of their illness. So another select all. Nursing care for a child with a tonsillectomy includes frequent pain medicine, giving them gum, offering them spicy food, or giving them an ice pack to the neck. All right, so the one that you would not want to do is the spicy food. You don't want to irritate their surgical site. Gum can kind of help with saliva. Frequent pain medication is primarily something like Tylenol, around the clock Tylenol, and then putting an ice pack to their neck. So a child post-tonsillectomy is swallowing every 2 minutes. What is the nursing priority intervention? Offer warm liquids, offer an ice collar, inspect their oral pharynx, or give them pain medicine? All right, so I've also seen sort of HESI or NCLEX style questions say that the priority is to notify the provider. When they're swallowing frequently, then you're worried about postoperative bleeding, so you need to intervene. Look, see if you see bleeding and or notify the provider. During a chloride or a cystic fibrosis sweat test, what 2 electrolytes are being searched for? Potassium chloride, sodium, magnesium. And there's 2 that are correct. Yeah, so it's a sweat test. Chloride is salt. It's we talked about them tasting salty, etc. Chloride almost always binds the sodium because one's a cation, one's an anion, and they bind each other. So these are the 2 you're going to look for on the sweat test. So the sweat test helps diagnose cystic fibrosis. Is that true or false? So that is true. Very good. So this one I'm going to skip. I don't like the phrase that she used. So the medication Albacet is used to treat fungal infections. Is that true or false? All right, so we did not talk about this. That one is true. So another select all that apply. How should a parent check for pinworms? Perform visual inspection of anus 2 to 3 hours after the child is asleep. Palpate the abdomen, tape a transparent tape around the perianal area. Remove the tape in the morning and place it in a glass jar and give it to the doctor. All right, so yeah, the blue and the green. So you're not necessarily responsible for looking at the tape yourself. You put the tape there and then you should put it in a glass jar and bring it in to be looked at. So which of these medications are not used for treatment of pinworms? I am bad at pronouncing these, so I'm gonna let you guys read these yourself. So the one that is not used is the Abraxane. The one thing I will say, like to try to remember, is the medications that end in AZOLE, the mebendazole and the albendazole. These category of medication are frequently used for worms or infections. So if you were to see these on a test when they end in the AZOLE, that is like that medication class you use for parasites. Okay, so there's a couple of you, Tiara and Sahara, that don't have your camera on. So I'm going to ask you to turn them on or you're going to have to leave class. Alicia, same with your camera. All right, second to last. Anabolic steroids are side effects include high blood pressure, jaundice, acne, and increased risk of cancer. And shrinking of testicles, increased aggressiveness, violent mood swings, or all of the above. All right, all of the above. Very good. So an oxygen or mistent that you would maybe use for a young child that has croup or cystic fibrosis have a flow of 5 to 10 liters, 12 to 15, 15 to 20, or 1 to 6. All right, so very good for the two of you that got that right, since we didn't talk about it. So this is not something that's attached to their face, so they're in an enclosed environment where the oxygen, they're breathing it in. All right, very nice job, you guys. Does anyone have any questions? Okay, so I'll post a recording of today's lecture and then 2 Kahoots, this Kahoot and another one that's a little bit more general pediatrics, but I still think it's a good resource if you're studying for the HESI. And I'll post an announcement later today with that information. And then I'll send you an email that has the immunization schedule and a PDF handout that you can also use as a study guide for the HESI. So does everyone hopefully knows where they're taking the HESI? If you're taking it on ProctorU, please remember that you need a dry erase board. They won't let you take the HESI with any paper. If anyone has any questions, go ahead and let me know. Somebody sent me a text message. So Deschantel, if you want to stay on after people leave, I'm happy to have a chat with you. Does anyone have any questions that you want to ask me before I let you guys go today? No? Okay. So everyone should be taking their HESI next week. And then week 12, we don't have if you would like to meet with me to go over your final grade, or if you have any final questions for the class, I have an open schedule next week or week 12 for anyone that wants to meet with me. So just send me a message. And then I encourage everyone to fill out the surveys that you were sent about the class. All right. So if no one else has any questions, you guys are free to go and send me a message if I can help you with anything with the HESI that's coming up. All right, so there's several of you. So Zakaya, Robert, Samuel, do you guys have any questions?
No, I'm sorry. My computer acting up. It was my Zoom acting up.
Okay, I can see you fine, but you don't have any questions, Robbie? Okay, I'm gonna go ahead and end the class then. If you guys have any questions, you can go ahead and let me know.